Welcome to our YouTube channel. Today we are going to discuss a very good topic known as low sperm count, and stick around to know what causes it, how do we treat, and which options are there. So low sperm count is also known as oligospermia, a condition in which the semen has less than a normal number of sperm cells. So many couples around the world struggle with infertility, and up to 50% of the causes of infertility actually come from the man. But men rarely know it, and they may blame their spouses for it until when we do the tests, we find out that they actually are the contributing party to the infertility. So let's stick around. Sperms are male reproductive gametes which fuse with the female egg to form a zygote, also known as your baby. So that's what a sperm cell is. And what are the different classifications of low sperm count? So if you want to know that, stick around and use this opportunity to smash the like button, comment on the page, like and share. YouTube will recognize this and it will recommend our video to others such that it can enable us to create more content. When you do this, you help us grow. Thank you so much. I appreciate you all for being here. So we classify it as normospermia if you have equal or more than 15 million cells of sperms per milliliter of semen. Mild oligospermia is if your semen has between 10 to less than 15 million cells per mil. Moderate is if it's between 5 to 10 million cells of sperms per milliliter. Severe is if it's less than 5 million cells of sperms per milliliter. A very rare condition, also known as cryptospermia, is if your semen has less than 100,000 sperm cells per milliliter. And that is very, very rare and very concerning, of course. So what causes this now that we've classified? What causes low sperm count? Stick around to know more. So we have conditions, medical conditions like varicocele. Varicocele is when veins within your scrotum enlarge, creating a very heated environment, which is not good for sperm production. Certain infections like inflammation of the epididymis or STIs can as well impair sperm production. And then you have issues like hormonal imbalances affecting the hypothalamus or pituitary gland or the testis itself. It can lead to low sperm count. Genetic abnormalities in some cases can also lead to a decrease in sperm production or the quality of the sperm that you produce. So these are some of the medical causes of low sperm count. We have lifestyle factors like overheating the testes, people who use saunas, hot tubs, or wearing tight pants all the time. You raise the temperature within your scrotum, and this impacts on sperm production. Other people who use drugs like alcohol, tobacco, and some illicit drugs can negatively affect sperm count and quality. And things like obesity. Being obese has been associated with hormonal imbalances, and as we saw previously, this can contribute to low sperm count, so you may want to work on that. Environmental factors play a big role. Pesticides, herbicides, heavy metals. People who work in industries can get exposed to these, especially if you don't wear personal protective equipment. X-rays, people who work in X-rays or laboratories that use these. And then environmental pollution, air pollution, water pollution, and exposure to toxins within your environment can as well affect sperm production. So you want to make sure when you're in these places, be protected. What are some of the signs and symptoms? Low sperm count may not have a very noticeable sign or symptom. However, some of the men that have low sperm count will also experience the following signs. You may have difficulty achieving an erection, or ejaculation problems, or reduced volume of the ejaculate. If you see this, highly suspect that there is low sperm count. So these are some of the signs. Then you could also have changes in appearance. A swelling or a lump in your testicle can show that perhaps there is a varicocele or something like a testicular tumor or something within your testis. How do we diagnose low sperm count? We do a comprehensive evaluation, including analysis of the semen. So we tell someone to ejaculate in a test tube, then we can analyze. So semen analysis is done we get a sample, and then we determine the count, the movement of the sperm, then the morphology. Some sperms have 2 heads, others 2 tails. The other is medical history, so we assess what are the underlying causes, then physical exam, of course, if you say swelling in the scrotum, like we talked about, and hormonal tests as well as blood tests. So we can take tests for follicle stimulating hormone, luteinizing hormone, or even testosterone, which is involved in helping to make sperms for you. Ultrasound can also detect any structural abnormalities or even varicocele within the scrotum. So these are some of the things that you can do to find out if someone has low sperm count or not. And then treatment options. Treatment depends solely on the underlying cause and the couple's desire to conceive. So possible approaches, we are going to look at it as we go on. So we could have a varicocele repair, which is identified as the cause of low sperm count. So you can do surgical repair or embolization to help. Others, if it's an infection, we give antibiotics prescribed to treat infections that can affect sperm production. So as you can see, these guys are operating on someone. Then others, you can do hormonal replacement if there's hormonal imbalance, like low testosterone. You may give hormonal replacement therapy, or modify their lifestyle, like avoiding exposure to high temperatures, avoid saunas, or moderate them, hot tubs, or even minimizing exposure to toxins or pollutants by wearing personal protective equipment if you are found in such an environment. So exercise can help with obesity. So weight management, you adopt a healthy lifestyle, including regular exercise, like we've talked about it, balanced diet, and do weight loss. This will help you with improving hormonal balance. And then quitting smoking or alcohol or those other illicit drugs that you have been using can be a good factor. For others, we can do assisted reproductive techniques, which include intrauterine insemination. Semen is introduced in the uterus itself to increase the chances of it meeting with an egg. Or in vitro fertilization, where we fertilize the egg in a test tube and then it forms a zygote and then we implant it in the uterus, an already formed small baby, like you can see on this slide here right now. Medications like clomiphene citrate stimulates the release of hormones that can improve sperm production. We can also give gonadotropin injections. Gonadotropins are hormones that stimulate your testes to produce sperms. And then you can also give antioxidant supplements like vitamins E, C, coenzyme Q, which help with finding those antioxidants within the body. And then psychological support, because low sperm count affects someone's esteem, so you may want to find a support group that talks to you, encourages you, someone who has been through it and managed, ask them how they cope. So it is important to know that treatment options may vary depending on individual factors and specific causes. Other people actually get a breakthrough and others may not, depending on how severe the cases are. Visit your specialist to know more. Thanks for watching, and please, if you haven't subscribed up to now, hit that subscribe button, turn on notifications. You will always get notified when we make these videos. Thank you so much.